Good afternoon, I'm Karen Hershey, and thanks for joining us for our live webcast with world-renowned eye surgeon Dr. Gulani. He's also founder of the Gulani Vision Institute right here in Jacksonville. And today we're going to be talking about surgical options for a degenerative eye disease called keratoconus. The National Keratoconus Foundation says this disease affects 2,000 Americans each year, and it's usually first diagnosed when someone is in their teens. Dr. Gulani has returned after teaching at the National Conference for Eye Surgeons held in Chicago last week, and he's here to talk to us about some recent breakthrough technologies involving keratoconus. So first of all, right off the top, what is keratoconus and what are the symptoms?
Keratoconus, Karen, is when the eyeball, we all have a clear cornea, as you can see, and the cornea is supposed to be dome-shaped in normal people. When that cornea becomes cone-shaped instead of dome-shaped, that's when the cornea is called kerato, meaning cornea, conus, like a cone. And then as you can imagine, I have some graphics we'll show. As you can imagine then, the cornea cannot, the glasses cannot correct the vision, and contact lenses cannot help the vision too, because they're kind of straddling this abnormally cone-shaped cornea. So keratoconus is a condition where the refractive error of the vision gets so bad because of the distorted shape of the cornea and makes it impractical for these patients to wear glasses or contacts.
Now you see patients from all over the world that have keratoconus. You offer a wide range of different surgical options for keratoconus. So what are the different treatments available to people?
For keratoconus, once they've tried glasses and contacts and they've exhausted all those treatments, there are various modalities nowadays, and some still in the pipeline that we've had the privilege to evaluate and see. But very popular nowadays is the Intacs surgery, where we're putting in tiny braces, if you may, into the cornea. Remember, by the textbook, the real treatment for keratoconus, the definitive treatment, has always been a transplant. But transplant is still an invasive surgery where replacing the whole cornea. That can still be done, but I would reserve that as the last resort. So to deal with the conus, as I said, because the cornea is cone-shaped, you want to somehow give it a shape so it becomes more dome-shaped, so they can wear contacts, glasses, and get about their lives. Now, the way I like to discuss it with patients is, I tell a patient with keratoconus, it's like as if you're 11 feet tall. Now, you cannot go to the mall and pick up a suit to go to a party tonight. So come on over here, let me put some braces in you, break you somewhere close to 6 feet tall. I don't know how close, whether you'll be 5 feet 8 or 6 feet 4, but that's what Intacs does. It takes you in the right direction towards the dome, but you cannot predict how exact to the dome. So when you put these braces into the cornea, pretty much the cornea is now more towards normal. So these people, I tell them, now you're close to 6 feet, you'll find a suit in the mall and you can wear that. It won't fit you perfect yet, all right? But you can get away with it.
But you're getting close to it.
Exactly.
Okay.
That's how
now we mentioned this Intacs corneal implants. And this is, from what I understand, one way to avoid a cornea transplant. So can you explain a little bit more about what these Intacs are, and
Sure.
are they painful?
No, not at all. Actually, we have some patients here with it. So if you see this, you can practically see the Intacs. I will actually brought some Intacs to show the viewers too. I'll put them on the palm of my hand.
Oh, they're so small.
They're extremely small. So if you see over here, we can see the rings and how the rings go. I'll show you a graphic video too, but these are actually how small the rings are.
They're tiny and they're very thin. I don't know if you guys can see them on the hand, but they're very, very small.
Extremely small. And these rings are kind of put into a channel into the cornea, and then they stay there and kind of bring the cornea down from a cone to a dome, and the patient can see much better.
Now, can you feel that? Because what are they made out of?
They're made of it's called an acrylate material, PMMA, but you cannot feel it because once it's in your corneal channel, you don't really feel it.
So you can't feel it at all, even though it looks like it.
No.
And you have an actual surgery?
I have an animation that I brought so our viewers can actually see.
How long does a surgery like this take?
Approximately 7 to 10 minutes, and it's done with numbing drops, so the patient's pretty much mildly sedated, and you can perform the surgery.
Do you do one eye at a time? Or?
Always one eye at a time. That's the safety protocol for Intacs, and also because each cone is so different, you get to learn from that eye how much more better you can make the other eye.
Okay.
So I'm going to now show the video animation of this Intacs surgery. Just make it.
Do you have to make a cut?
You make a small channel with a diamond instrument, and then you can kind of enter the cornea. I'll show you everything, and we can see it pretty much right here. So here we go.
Well, only 7 to 10 minutes seems pretty amazing.
Here we go.
Okay.
So that's the Intacs surgery being shown in animation. As you can see here, that's the channel being created, and that's the ring which will now go into the cornea in the channel that was created. And this is showing you now how the cornea flattens. If you notice that center cornea, see how it flattens? That's what I mean by the cone becoming more of a dome. And even the Intacs can be done in such a way that we've made it an art. You can put it in different directions on the cornea because each one's cone is different. So we'll see that with the patients we have today, how different it looks and how it corrects each one differently.